Have you ever gone to bed feeling completely normal only to hear the heartbreaking news that someone passed away peacefully in their sleep? For many families, it comes as a total shock. There were no loud warnings, no dramatic symptoms, and no sign that anything was seriously wrong. But the truth is, the heart sometimes gives subtle warning signs, especially during the night. The problem is that many people mistake these symptoms for stress, aging, poor sleep, or simple fatigue. Now, let's be clear, no single symptom can predict a heart attack or stroke, and many people who experience these signs have causes that are not related to heart disease. But recognizing possible warning signs early and getting medical advice when needed could make a life-changing difference. In today's video, we're going to discuss 6 nighttime heart warning signs that should never be ignored, especially if you are over the age of 50. These signs don't always mean something serious is happening, but they are worth paying attention to because your heart often sends small signals before a major problem develops. We'll also explain why these symptoms happen, who is at higher risk, and when it's important to seek urgent medical care instead of waiting until morning. Remember, this video is designed to help you become more aware of your health, not to create fear. The goal is simple. The earlier heart problems are detected, the better the chances of preventing serious complications. So, if you or someone you love is over 50, stay with me until the end. The final warning sign is one that many people dismiss as just getting older, yet it deserves medical attention. Welcome to Dr. Bilal, where we turn complex medical information into simple, practical advice to help you live a healthier and longer life. Now let's begin with the first 2 nighttime warning signs. Remember, experiencing one of these symptoms does not automatically mean you have heart disease. Many conditions can cause similar symptoms. However, if these warning signs occur repeatedly, become more severe, or happen together, they should never be ignored. Warning sign. Number 1. Waking up with chest pain or pressure. Have you ever been awakened in the middle of the night by a strange feeling of pressure, tightness, or discomfort in your chest? Some people describe it as if someone is sitting on their chest. Others feel a squeezing, burning, or heavy sensation that lasts for several minutes. Because it happens during sleep, many people assume it's just indigestion, acid reflux, or sleeping in an uncomfortable position. While those causes are certainly possible, chest pain that is new, severe, or recurring can also be a warning sign of a heart problem. Sometimes the discomfort spreads to the left arm, shoulder, jaw, neck, or back. It may also be accompanied by sweating, nausea, dizziness, or shortness of breath. If chest pain lasts for more than a few minutes, becomes intense, or is accompanied by these other symptoms, do not ignore it. Seek emergency medical care immediately. Quick treatment can make a critical difference during a heart attack. Warning sign number 2, waking up short of breath. The second warning sign is suddenly waking up gasping for air or feeling like you can't catch your breath. Many people blame this on nightmares or poor sleep, but in some cases, it can be related to the heart. When the heart is not pumping blood effectively, fluid may build up in the lungs, making breathing more difficult, especially when lying flat. Some people notice they need extra pillows to sleep comfortably or wake up several times during the night feeling breathless. Others find that they feel better after sitting upright for a few minutes. It's important to remember that shortness of breath can have many causes, including asthma, lung disease, anxiety, or sleep apnea, a condition that itself can increase the risk of high blood pressure and heart disease if left untreated. If nighttime breathlessness is frequent, worsening, or occurs along with chest pain, swelling in the legs, or extreme fatigue, don't wait for it to go away on its own. Arrange a prompt medical evaluation. These first 2 warning signs may seem easy to dismiss, but they can sometimes be your body's way of telling you that your heart needs attention. Let's continue with 2 more nighttime warning signs that many people ignore. Because these symptoms often come and go, they're easy to dismiss. But if they happen repeatedly or are accompanied by other concerning symptoms, it's important to speak with your healthcare provider. Warning sign number 3, a fast or irregular heartbeat. During the night. Have you ever been asleep and suddenly woken up because your heart was racing? Some people describe it as pounding, fluttering, skipping beats, or feeling like their heart is beating out of their chest. It may last only a few seconds, or it may continue for several minutes. There are many possible reasons for nighttime heart palpitations. Stress, anxiety, caffeine, alcohol, certain medications, dehydration, and poor sleep can all trigger them. In some cases, however, they may be caused by an abnormal heart rhythm, also known as an arrhythmia. While occasional palpitations are often harmless, frequent episodes should not be ignored, especially if they are accompanied by dizziness, chest discomfort, fainting, or shortness of breath. Keeping a record of when these episodes occur and discussing them with your healthcare provider can help determine whether additional testing, such as an ECG or a heart monitor, is needed. Warning. Sign number 4, waking up covered in cold sweat. Most people expect to sweat after exercise or during hot weather, But waking up in the middle of the night, drenched in cold sweat without an obvious reason, deserves attention. Cold sweating can happen for many reasons, including infections, low blood sugar, anxiety, or certain medications. However, it can also occur during a heart attack or another serious heart condition. When cold sweating happens together with chest pressure, pain spreading to the arm or jaw, nausea, or difficulty breathing, it should be treated as a medical emergency. Even if there is no chest pain, repeated episodes of unexplained night sweats should be discussed with your healthcare provider. While they may not be heart-related, they can sometimes signal another medical condition that needs evaluation. The important message is this: don't ignore symptoms simply because they happen while you're sleeping. Your body may be sending you an important signal that deserves attention. We've reached the final 2 nighttime warning signs. These symptoms are often overlooked because they develop gradually. Many people assume they are simply part of getting older, but in some cases they may be linked to an underlying heart condition or another health problem that deserves medical attention. Warning, sign number 5, swollen feet and ankles that are worse at night. Have you noticed that your shoes feel tighter in the evening than they do in the morning? Or maybe your socks leave deep marks around your ankles before bedtime. Mild swelling can happen after standing or sitting for long periods, especially during hot weather. However, persistent swelling that continues day after day may be a sign that your body is retaining extra fluid. One possible reason is that the heart is not pumping blood as efficiently as it should. When this happens, fluid can collect in the legs, ankles, and feet. Some people also notice that the swelling improves after sleeping with their legs slightly elevated. Of course, swollen ankles can also be caused by kidney disease, certain medications, vein problems, or other medical conditions. That's why it's important not to jump to conclusions. But if swelling is getting worse, occurs together with shortness of breath, chest discomfort, or sudden weight gain, you should contact your healthcare provider promptly. Warning, sign number 6, extreme fatigue. After a full night's sleep. Everyone feels tired from time to time, but waking up every morning, feeling completely exhausted even after getting enough sleep, is not something you should simply ignore. Your heart is responsible for delivering oxygen-rich blood throughout your body. If it isn't working efficiently, your muscles and organs may not receive the oxygen they need. As a result, even simple daily activities can leave you feeling unusually weak or drained. Persistent fatigue can also have many other causes, including anemia, thyroid disorders, sleep apnea, depression, certain medications, or poor quality sleep. This is why a proper medical evaluation is so important. If your tiredness is new, continues for several weeks, or is accompanied by breathlessness, chest discomfort, dizziness, or swelling, make an appointment with your healthcare provider, rather than assuming it's just part of aging. What should you do? If you notice these warning signs, the first step is simple. Don't panic, but don't ignore them either. Keep a record of your symptoms. Write down when they occur, how long they last, and whether they are becoming more frequent or severe. This information can help your healthcare provider identify possible causes more quickly. If you have been diagnosed with high blood pressure, diabetes, high cholesterol, or heart disease, continue taking your medications exactly as prescribed and attend your regular checkups. Living a heart-healthy lifestyle can also make a big difference. Eat a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Stay physically active, avoid smoking, limit alcohol, manage stress, and aim for 7 to 8 hours of quality sleep each night. Most importantly, if you experience severe chest pain, sudden shortness of breath, fainting, or symptoms that suggest a heart attack or stroke, seek emergency medical care immediately. Acting quickly can save heart muscle, and it may even save a life. In the final part, we'll summarize today's key lessons and share one simple habit that can help you recognize potential heart problems before they become serious. Stay with me until the end. Now let's take a moment to bring everything together. Your heart works every second of every day, even while you sleep. Most nights, it beats quietly in the background without asking for attention. But sometimes it sends small warning signs that should never be ignored. The challenge is that these symptoms are often subtle. Many people blame them on stress, poor sleep, or simply getting older. Today, we discussed 6 nighttime warning signs that may deserve medical attention. Chest pain or pressure, waking up short of breath, a fast or irregular heartbeat, unexplained cold sweats, persistent swelling in the feet and ankles, and extreme fatigue, even after a full night's sleep. It's important to remember that none of these symptoms alone prove that you have heart disease. Many other medical conditions can cause similar problems. However, if these symptoms are frequent, getting worse, or appear together, they are your body's way of telling you that something may need to be checked. One of the best ways to protect your heart is to stop ignoring changes in your body. If something feels different for several days or weeks, don't assume it will simply go away. A simple medical checkup, blood pressure measurement, blood test, or heart examination can sometimes detect problems long before they become serious. Your daily habits also matter more than you may realize. Eating a heart-healthy diet, staying physically active, maintaining a healthy weight, getting enough sleep, avoiding tobacco, limiting alcohol, and managing stress all help reduce your risk of heart disease over time. Small improvements made consistently can have a powerful impact on your long-term health. If you already have high blood pressure, diabetes, high cholesterol, or a family history of heart disease, regular follow-up appointments are especially important. Taking your medications as prescribed and keeping your medical conditions under control can significantly reduce your risk of complications. The goal of today's video was not to create fear. It was to help you recognize that your body often gives early warning signs before a serious problem develops. Listening to those signals and acting early could make all the difference. Thank you for spending your time with Dr. Bilal. If you found this video helpful, please like this video, subscribe to the channel, and turn on notifications so you never miss our latest evidence-based health tips for adults over 50 and 60. Take care of your heart, look after your health, and remember, small changes today can help protect your tomorrow. Thank you for watching, and I'll see you in the next video.